So I have talked briefly about how you can transfer the your weight bearing line from one compartment to the other, and because this compartment is untouched, it is native and it is not affected, so your weight bearing really improves. So you have painless weight bearing, you have painless motion, you can walk, you can run the marathon, you can go for hiking, you can go for swimming, you can go for diving. So the possibilities are really endless. So by way of this osteotomy, which we call the high tibial osteotomy, we can get your alignment corrected, and by this you can enjoy your normal natural life. So that is in brief, in a nutshell, how by endoscopic procedure we can align the patella, we can align your knee joints where you have a knee bow legs or knock knees, so we can get this thing corrected. Now I'd like to talk about one specialized thing again, so which is again unique in its own form and which is not so popular here in this country. Suppose you have, we get females, adolescent girls, young young ladies who have a lot of knee pain and who are not really into the stage of arthritis. So, but they have knee pain on bending or kneeling, doing the household work. So they have complain a lot of knee pain while climbing stairs and things like that. Now, if you go into the history of these patients, they have an alignment, malalignment of the knee joint. They have also have some deformity in the femur. They also have deformity in the tibia, which is this is shin bone. So in these kind of special cases where you have this rotational sort of malalignment, so you can do one other thing in addition to the balancing surgery on the patella, the endoscopic procedure, which I have talked about to balance the patella. So we can do another thing. We can make a bony correction about this area where the patellar ligament attaches to the bone. This is called the area of the tibial tubercle, which is a bony prominence around the tibia. So we can do an operative correction around this tibia. So get the tibial tuberosity in alignment with the patella so that it tracks again well, and you can do away with the pain. So this is another, in brief, operative correction whereby young patients, young adolescent females, young adults, so who are having knee pain and who are having restriction activities owing to this kind of pain, so we can get the patellar balance. And this is really a short incision procedure where you do not have a lot of hassle, and the rehabilitation is really quick. So you can get back to your normal sports like running marathon. You can get back to playing basketball, golf, or soccer for that matter. So you can really do that. So this is another means of preservation of your natural knee joint. The other point which I forgot to mention was that since we are correcting the malalignment of the patella, we are correcting the malalignment of the knee joint. So it enhances the longevity of the natural knee joint. So if you suppose, given the fact that you are 45 years of age and you have a lot of knee pain and you don't do anything, so it goes on to arthritis, rapid arthritis, within a span of maybe 5 or 6 years down the line. So you could end up with an arthroplasty of knee joint, which is really not welcome at this age group around 50. So we like to delay knee replacement beyond at least 60 years, 65 years of age. So this kind of procedure also enhances the longevity of a knee joint by another 15-20 years. So you can buy your time, and even if you require, say, you have a need for arthroplasty when there is a tibiofemoral arthritis in the long run, so getting that alignment to balance by means of knee arthroplasty is really not another big deal. But it can be done, because we have specialized robotic surgeries. We have navigation procedures by which the computer can tell you what is the angulation, what are the cuts to be made in the knee joint. So by these kind of means, we can also get that corrected. So in brief, so these are the procedures about the knee joint where you can really, based on these kind of osteotomies, based on these kind of endoscopic procedures, we can balance your patella, we can balance your knee joint, balance your weight bearing. So all this leads to a normal, lifestyle, nearly 100%, I would say. And this enhances, the longevity of a natural knee joint. So there is nothing, compared to your natural knee joint. If you compare your natural knee joint to your artificial knee joint, most would agree that I would like to stay with my natural and native knee joint and not, really enjoy with my artificial knee joint. But if the need be, of course, you can get it replaced. But these kind of corrective procedures, they're coming up in a big way, and I have plans to get this going for the benefit of all and many patients that come into my clinic. I hope you have enjoyed the session, and if you do have questions, you're free to ask me anytime. Thank you very much for your attention.